CDC health data that scientists rely on isn't available because of the government shutdown.
And as Sabrina Wilson reports, economists also aren't getting numbers they count on.
As the government shutdown continues, it's being felt in a myriad of ways, including access to important health data.
I use data from the CDC to monitor infectious diseases, especially COVID-19. And what I do is I take the CDC data, which are sometimes difficult for people to understand, and translate them into numbers people can use that are used by patients, families, public health programs across the country.
This note referring to the shutdown is on the CDC's website. Dr. Michael Herger is program lead for population science at the Tulane Cancer Center.
Right now, the CDC website that monitors COVID is basically shut down. There haven't been any data updates in weeks. And so that means I can't get the numbers to people so that they can take appropriate precautions to avoid getting COVID.
Wastewater monitoring helps detect outbreaks early.
Before that, we had really good testing-based data, and then testing basically fell away. And so I started taking the wastewater data, which is very unfamiliar to people, and making that in more useful numbers that people can understand.
The shutdown is also affecting the availability of numbers economists count on to gauge the jobs picture.
Some of the data that economists rely on to measure the economy aren't coming out because the people that produced it are being furloughed right now. So we didn't get our last jobs report. We've got some indications that says that the job market is really getting tougher.
On top of that, UNO economist Dr. Walter Lane says when many federal workers aren't being paid, there's an effect.
Part of it is just looking at how it affects the overall economy. As well, if you're not getting your paychecks, you're probably not buying as much as you have. And if you're worried that you not only are being furloughed, but maybe laid off, that's going to make people not be wanting to spend.
He says spending drives the economy.
If a person misses a paycheck, most of us these days, that's really bad. If you start missing 2 paychecks, then things get really, really serious. And as this drags on, it's getting a little scary.
Back on the COVID data front, Dr. Herger offers advice.
There's likely to be a winter wave. There's been a winter wave since the pandemic began. And so the best thing you can do right now is go out and get your booster. You do not need a prescription. Louisiana was one of the last states to roll that out without a prescription.
Dr. Herger says there are other data sources he can use, but they aren't as rigorous. He says the CDC's infectious disease monitoring system is the best in the world. I reached out to the Louisiana Department of Health for this story, but did not hear back.